Let's start the drug, the pharmacology of parasympathetic system, cholinergic agonist. The first category of drug for parasympathetic system, cholinergic agonist. The cholinergic these drugs, some they directly go to the receptor and excite the receptor and helping parasympathetic system stimulation. The few drugs, the second group of drug, inhibition of cholinesterase. What is cholinesterase? Is the enzyme. Is the enzyme present in synaptic space. This enzyme present in synaptic space. This enzyme help for what's the normal function of this enzyme? This enzyme help in breakdown. This enzyme help in breakdown. The help for the breakdown of the system, breakdown of acetylcholine. The breakdown done by this enzyme, if you block this enzyme, it's mean you helping acetylcholine stay for a long time, a long duration. Acetylcholine is increased in synaptic space. These are two drugs, the two category of drugs, the drug directly acting and drug indirectly acting. Direct acting drugs they directly go for receptor. In indirect acting drugs for parasympathetic system, also known as mimetic. Mimetic means is agonism. Is agonist. The mimetic word is the alternative word for agonism. And these are two drug groups acting on parasympathetic system: direct acting, indirect acting. Direct acting drugs occur two groups by chemical nature and the derivative of plant alkaloid, the pilocarpine, and the drugs, the derivative is similar to acetylcholine, carbachol, and botanicol and methicholine. Carbachol, botanicol, and acetylcholine. So one clinical point about acetylcholine: we're not using acetylcholine as drug in clinic. Why? We can't inject, we can't give, we're not able to give the patient give acetylcholine. The acetylcholine, we having one thing, the person can't eat acetylcholine because the liver have the pseudo acetylcholine esterase enzyme. Pseudo acetylcholine esterase. This enzyme present also present in the liver and present in the blood. And this pseudoacetylcholine esterase enzyme can break this acetylcholine if entering the body. So acetylcholine alone is not used like a drug. So drug is anything come from outside. The chemical carbachol, botanicol is similar structure like acetylcholine, but these are the medicine we can apply to the person. The acetylcholine not used as drug from the outside. Okay, another drug, the pilocarpine, is a very effective drug in eye for ophthalmology purpose. Okay, now move on indirect category. The first class is the reversible. If the enzyme, if the acetyl anticholine cholinesterase drug, these drug against the acetylcholine esterase enzyme. These drug block the enzyme. They reversibly block, they temporarily block the enzyme. The stigmine family, neostigmine, rivastigmine, and we also having donepezil. We also having galantamine. So these are the drugs: neostigmine, rivastigmine, tacrine, donepezil, and galantamine. And these drugs are indirect acting, reversible. These are reversible drug. And irreversible drug, we having drug here ecothiophyte. Ecothiophyte is irreversible drug. And organophosphate compound is also have clinical relevance. Organophosphate is not used as a drug, but this organophosphate used in the fertilizers, like in the cropping in the fields, used as fertilizers. These organophosphate were used as fertilizers. Organophosphates. The organophosphate enter the body. Organophosphate can block acetylcholine esterase and what happened to patient. These all drug, you can see all drug, they stimulate the function of parasympathetic system. So these all drug acting directly or drug acting indirectly. What happened with parasympathetic system? The all function of parasympathetic system will be high. The working too much, And for example, here these are the drugs here. But what is the organophosphate here? The organophosphate is not used like a drug, but organophosphate, if the person eat organophosphate for suicidal attempt, for suicide, or organophosphate accidentally enter to the body, what the organophosphate are doing? Organophosphate, again same like other drugs, organophosphate also increase the activity of parasympathetic system. They're similar to spider venom, spider, what's doing with the parasympathetic system, the overstimulation of parasympathetic system. The same thing happen in organophosphate poisoning. In organophosphate poisoning, if you understand the mechanism, what's going on inside the body in the organophosphate poisoning case, you can control the sign symptom of the patient. You can handle the patient, what to use inside this patient. If patient comes in clinic with organophosphate poisoning, I need to block the parasympathetic system. This we will learn later in parasympathetic blocking drugs. Okay, side of action. It's already explained the side of action: direct action, indirect action. The direct action, muscarinic receptor, the drug directly going bind and receptor, and if the drug, that's what the drug is doing. Indirect drug, they block the acetylcholinesterase. The drug, for example, indirect drug, or if they reversible block, they can block this enzyme irreversibly by two ways: permanent block and temporary block. They block this enzyme, then no more breakdown. What happened here? Acetylcholine level increase, and this drug directly stimulating the receptor, non-acetylcholine here, directly stimulate the receptor. So what happened? Parasympathetic function will be increased. The mechanism of action of direct and indirect drugs. Here, see the summary of the indirect drug and direct drug. It's a botanical and carbachol and botanical. These drug, pilocarpine, carbachol, botanical. These drugs directly acting on muscarinic receptor. These are the direct acting drugs. The direct acting drug, they stimulate the action of smooth muscle, acting on M1 receptor, acting on M2 receptor, acting on M3 receptor. And all these drugs, they have more concern with muscarinic receptor. Also can influence the activity of nicotinic receptor. Also can influence. It's a direct acting drug. The indirect acting, you can see here reversible, irreversible. The ecothiopate is indirect acting, but organophosphate, these are not a drug, it's a poison entered your body. The reversible is the stigmine family: neostigmine, rivastigmine, dacrine, glantamine, neostigmine, rivastigmine, physostigmine, dacrine, glantamine, and donepezil. These drugs, they block this enzyme and no more breakdown into acetylcholine and acetate. This is a waste product of acetylcholine after the breakdown. The acetylcholine level will be increased. This indirectly. Then this acetylcholine have more action on nicotinic receptor also, and have more action on muscarinic receptor also. The one clinical point here, nicotinic receptor also present a neuromuscular junction. The direct acting drug here, if we go back to the direct acting drug, these drugs have more concern with the nicotine, have more concern because these drugs directly going to muscarinic receptor, have little activity of nicotinic receptor. The pilocarpine mostly going to muscarinic receptor, they have little affinity for nicotinic receptor. So these drugs we not use for the purpose if any person having neuromuscular junction issue like the myasthenia gravis, the muscle weakness, we can't improve by using these drugs. But these drugs, indirect acting drug, we also can apply for neuromuscular junction function. If neuromuscular junction is not working properly, the muscle contraction is weaker, we can apply these drug for improvement in contraction. The muscarinic receptor activation is a summary here. The muscarinic receptor, what happened with the M3 receptor in the eye. Here we see the different organs, what happened in the eye, what happened in different with the parasympathetic system. If we stimulate the muscarinic receptor in the eye, what happened? Or GQ protein activated, is the calcium level increase, smooth muscle contract, and what happened? The eye pupil constrict. The meiosis is caused by parasympathetic stimulating drug. In the ciliary muscle, for accommodation for near vision is a function of parasympathetic system. Accommodation for far vision is a function of sympathetic system. Now the parasympathetic system, the stimulating drug, they can improve. They're doing the function here. The for near vision of using parasympathetic drug, stimulating drug, it can interfere with the far vision. The accommodation of far vision will be disturbed. And the meiosis there, the meiosis. This person having complaint, it can't see the more clearly for far object, but near objects is more better. Near object, the vision is better, but as compared to far object become a bit blurry. What happened with the heart? The heart, here you can see the heart rate, the muscarinic receptor, the M2 receptor, N2 receptor decrease the activity of heart, decrease the heart rate. And what have respiratory system, the M3 receptor, GQ protein, it's a GI protein linked with the muscarinic receptor 2, and GQ protein linked with, we all had done before in the previous video. And the M3 receptor linked with GQ protein and causing calcium, this calcium increasing causing bronchodilation, and also increased secretion inside the respiratory tract. This is the function of these different receptors present on different organs. They're doing different function. And GIT function, the parasympathetic receptor, M3 receptor, what happened? GIT, more motility, more acid production, more secretion, more motility. What happened inside the bladder? And what contraction of the tricep muscle? What happened? Bladder contraction or micturition start. In the bladder, urinary system increase micturition. So what happened? The gland increase salivation, increase lacrimation, increase salivation. It's a function of parasympathetic system. The parasympathetic on the blood vessel, what happened? The blood vessel, the GQ protein activate nitric oxide synthesis and production of nitric oxide inside endothelial cell and causing vasodilation, and vasodilation decrease blood pressure. Okay, these are the summary of the full parasympathetic system according to receptor location. So when we apply parasympathetic drug, what happened inside the eye? Meiosis. What happened inside for the vision? The vision also affected by parasympathetic stimulating drug. The vision for the far object become blurred. And what happened with the heart rate? The heart rate going low. And what happened? The heart rate going low, the blood pressure going down. And what happened? Respiratory tract, the bronchodilation. The bronchodilation, sorry, here the one problem here, the it must be bronchoconstriction. It's not bronchodilation, it must be bronchoconstriction. The respiratory tract, the bronchoconstriction done by parasympathetic system. Bronchodilation is function of sympathetic system. The bronchoconstriction start, it's not dilation. And the secretion increase, bronchoconstriction. And what happened? GIT, motility increase, or the person, it can lead to diarrhea if overactivity of these drugs. The secretion and motility will increase. HCl also very high. Okay, bladder is lead to micturition. The parasympathetic bladder is lead to micturition. The gland, it leads salivation and lacrimation there. The blood vessel, the vasodilation, decrease the blood pressure. So nicotinic receptor activation. Nicotinic receptor, I'll explain activation, the ion channel. The nicotinic receptor and the receptor present over the nerve to nerve. The activation of both systems, because the ganglia also present in sympathetic system, also present in parasympathetic system. The neuromuscular junction receptor, NM type, the ion channel is causing what? Depolarization of skeletal muscle. So these drugs also sometimes effective if neuromuscular junction is not working. If neuromuscular junction is not working, to improve the electricity, to improve the conduction of a neuromuscular junction. For example, disease that we discussed, disease myasthenia gravis. These drugs very effective in myasthenia gravis treatment. The pharmacology, what are the action of this pharmacological action? While it done all the action is just a repetition here. The CVS system. What happened? The heart rate decrease. What happened with the blood vessel? The blood vessel that decrease, the blood pressure decrease, vasodilation there. What happened? GIT, HCl increase, the same thing, intestine secretion increase, a more motility lead to diarrhea. The bladder relaxation sphincter promote micturition, or it lead to micturiation, and bladder the rest muscle contraction lead to micturiration. This happen inside. Exocrine gland. What happened? Exocrine gland, more stimulation, lacrimation, salivation, sweating also can start, and the meiosis. What happens inside the eye? Accommodation for near vision is better, but intraocular pressure decrease intraocular pressure is very important use of these drugs. These drugs can reduce intraocular pressure. Later I will explain this drug very effective in the one disease condition known as glaucoma, very better. The blood vessel dilation there are the decreased blood pressure, decreased heart rate, decreased blood pressure, decreased heart rate. This just a bit summary of what these drugs are doing with the body. These drugs, we start from up to down. What happened inside the eye? Inside the eye, what happened inside the eye? Pupil size constrict of meiosis in the eye. The eye, when the eye doing the meiosis, the accommodation for the near vision is better as compared to far vision. The far vision, this person have complained of blurry far vision. And what happened inside the heart? Heart rate going low if you're using the parasympathetic stimulating drugs. And what happened with the blood pressure going down because of vasodilation? What happened with the respiratory system? Respiratory system, bronchoconstriction start and increase the friction. What happened with the GIT? More motility, more secretion can lead to overstimulation, can lead to diarrhea. What happened with the urinary system? The bladder contraction, it can cause maturation. What happened with the glands? With the gland, it lead to more salivation and more lacrimation. So these are general effects that are caused by these drugs. Okay, now go for the direct acting. What a therapeutic uses, what therapeutic application of these direct acting and indirect acting drug. I will talk about therapeutic application. The acetylcholine is a no use. I am not going to use acetylcholine. Or as a 1% I can use for with eye, but no clinical use. Why? Because we have acetylcholine esterase, pseudoacetylcholine esterase present inside the plasma. Is come from liver. It can break the acetylcholine if come from outside. If come from outside, that acetylcholine is a breakdown. So we not use acetylcholine as the medication. What's the botanical? What's the use? Now we focus on the use. This slide is very important slide. The atonic bladder. What's the meaning of atonic bladder? The bladder is not working. The bladder is not working. Neurogenic bladder. Maybe in the diabetes. Maybe after surgery, the bladder not working. To increase the activity of bladder, I can apply botanical. I can apply botanical or other drug. Non-obstructive. There must be one condition. The urinary retention. Bladder is not contraction. So what happened? Urinary retention there. If there's a stone, it's an obstruction of the stone. One very important thing must keep in mind when using botanical for urinary retention, you must make sure it's not a stone. If the stone is the stone there and using botanical and the bladder will start strong contraction, what happened? The bladder starts strong contraction. If strong contraction, the stone there, the bladder can rupture. The bladder gets strong. That very much too much pain there because already stone there. So they must make sure the person not having stone. And the use of this drug, the post-surgery, the GIT is the effect of anesthesia. What happened with the GIT? GIT is not working. The person, mostly having constipation after surgery because of effect of anesthesia. So we can apply this drug to improve the GIT motility, improve the bladder motility. We also can apply in Chagas disease. What is Chagas disease? It's lead to constipation. It's affect the Chagas disease, trypanosomiasis, destroy meningeal plexus. So we can apply this drug. We can apply this drug in Chagas disease also. For constipation purpose and urinary retention, I'm using botanical. The carbachol is not my selective action. I can use for glaucoma also. I can use for glaucoma carbachol. The best drug for glaucoma, must keep in mind the pilocarpine. Pilocarpine I'm using for emergency case of glaucoma. The pilocarpine, what doing the pilocarpine doing here with the eye, the meiosis. When the eye under the process of meiosis, what happened with the intraocular pressure? Intraocular pressure will be low. The intraocular pressure, if going down, it can improve the glaucoma condition. It can prevent the blindness. So emergency glaucoma must go for pilocarpine. Okay, another condition here, the return to Sjogren syndrome. Why I'm using pilocarpine in Sjogren syndrome? What is Sjogren syndrome? It's a disease of salivary gland. It's a disease of salivary gland, destruction of salivary gland, no saliva there. If no saliva there, I can use pilocarpine to improve salivation. Also, I'm used for Sjogren syndrome. What's a xerostomia? Dry mouth, no salivation. Same thing here. I can use for, okay, next thing, cystic fibrosis. What is this disease? The cystic fibrosis is a disease of exocrine glands, affecting mainly exocrine gland. the secretion become very thick. To diagnose this, this cystic fibrosis is diagnosed by skin test. We use the skin test. The skin become much salty. We check the much salty skin in the cystic fibrosis child. The bone with cystic fibrosis having very salty skin, just to collect the sweat. To understand, to count the salt concentration inside the saliva, inside the sweat. We check the sodium chloride. Inside the sweat. So for that purpose, we can put 1 drop of pilocarpine over skin and collect the sweat. Why pilocarpine? Because pilocarpine is a parasympathetic agonist. The parasympathetic system, the sympathetic system also increase the sweating. Also can increase sweating. Also acetylcholine also can increase sweating. So we can use for this purpose also. The uses of direct acting drug. The very important drug, must keep in mind the pilocarpine. Another drug, botanical carbachol. The botanical we can use for bladder, the post surgery. If the atony of GIT, post surgery atony of unibladder, I can prefer botanical. I can use for urinary retention and constipation. Urinary retention and constipation can be. Constipation must be. They must keep in mind there must be a non-obstructive case. If obstruction of intestine and constipation, you're giving botanical, you're doing a big mistake here, because the intestine can rupture. After the application of botanical. Botanical increase motility. So if obstruction already there, must make sure this obstruction, the constipation not caused by obstruction, urinary retention not caused by obstruction. There must be neurogenic issue, excitation of the bladder, excitation of intestine is decreased. So we can, at that time we can apply this drug. It's about the summary of these 2 drugs, the botanical and pilocarpine, very important, pilocarpine. Okay, next we move on indirect acting. Indirect acting, first thing is adrophonium. What's the use of adrophonium? What's the important thing about adrophonium? Must keep in mind the short acting. This drug is not used for treatment of myasthenia gravis. This drug we use for diagnosis of myasthenia gravis. For example, one patient come to you, the patient having myasthenia gravis. What happened in myasthenia gravis? The muscle is weak, because myasthenia gravis, acetylcholine receptor. The antibody produced inside the blood and attack this receptor. And what happened with this receptor? Receptor gone. If receptor gone, the acetylcholine, so acetylcholine is not acting on the muscle. What happened with the muscle? A muscle under the paralysis, the muscle not receiving depolarization, because no acetylcholine is acting on this muscle receptor, on nicotinic and NAM receptor. So adrophonium, when you give adrophonium, the muscle contraction improves. It means you can diagnose myasthenia gravis with adrophonium. You can diagnose myasthenia gravis with adrophonium. Adrophonium improve the muscle contraction when we apply to the patient. Another condition, cholinergic crisis. Why we use for this? What is cholinergic crisis? Later I explain this condition, because now it's a bit hard to understand. Okay, next thing, phyllostigmine. Phyllostigmine is tertiary amine. If the tertiary amine must go to brain, it can go to brain. Phyllostigmine can go to brain. If it can go to brain, I can use for phyllostigmine. I can use for Alzheimer's disease. The phyllostigmine can go to CNS. Also can applicable for Alzheimer's disease. What's a better drug for Alzheimer's disease? Very good drug. Lipid-soluble drugs we have here. These 4 drugs: tacrine, donepezil, rivastigmine, glantamine. These are lipid-soluble, rapidly cross blood-brain barrier. So very best for Alzheimer's disease. What happens in Alzheimer's disease? Acetylcholine level is low in frontal lobe. So we can improve. Tacrine is no more use. Why? Because tacrine causing hepatic damage. So tacrine is not much use. The donepezil, rivastigmine, glantamine still we use in Alzheimer's disease. Still we are using in Alzheimer's disease. Okay, the neostigmine and pyridostigmine. The treatment of choice for the quadriamine, they're not going to CNS. The neostigmine, pyridostigmine, the quadriamine, I can use for atonic bladder. I can use for atonic intestine. So I can prefer for intestine, I can prefer for GIT, but the best use of these 2 drugs for myasthenia gravis. For myasthenia gravis, treatment of choice for myasthenia gravis, pyridostigmine, neostigmine. Pyridostigmine, neostigmine. Pyridostigmine, neostigmine. Pyridostigmine, neostigmine, I can prefer for myasthenia gravis. These two drugs. Okay, one patient come to you myasthenia gravis. How you diagnose that patient? Use adrophonium. Adrophonium. This test is known as Tensilon test. It's a Tensilon test. In the Tensilon test, we check what with adrophonium. Apply adrophonium to patient. The muscle contraction will be improved by application of adrophonium. After application of adrophonium. Now, it is not the best test to diagnose myasthenia gravis. Now, best test we can go for antibody present in the blood against the acetylcholine receptor. Before this test, the antibody discovery, we're having the adrophonium test, the best test to diagnose the myasthenia gravis. But nowadays, it's not the best test. It's not the best test. The Tensilon test is not the best test to diagnose myasthenia gravis. We can go for antibody, searching antibody present inside the blood against the acetylcholine receptor present over the muscle. Okay. Next, we'll be talking about the myasthenia gravis. The best drug for myasthenia gravis is pyridostigmine, neostigmine. These two drugs I can apply for treatment of myasthenia gravis. But when patient come to you, you apply myasthenia gravis. The patient take overuse of these two drugs. What happened? That these two drugs actually they improving acetylcholine. Now what happened to patient? If the patient take overdose of these two drugs, acetylcholine level very high. What's the receptor present over muscle? Nicotinic and M receptor. This receptor linked with, it's not a G protein, it's linked with ion channel. You know, ion channel have one property. If you repeatedly stimulate ion channel become inactive. This receptor become inactive or it's a tachyphylaxis. Very rapidly undergo tachyphylaxis. No, because very high level of acetylcholine, pyridostigmine, neostigmine, increased level in synapse. In the neuromuscular junction, very high level of acetylcholine, what happened? Receptor become inactive. If this receptor become active because of acetylcholine, this condition is cholinergic crisis. Now you better understand. It's a cholinergic crisis, very high level of acetylcholine at neuromuscular junction. Very high level of acetylcholine at neuromuscular junction. Now this patient again feeling weakness of muscle. Now attend another doctor. Now change the physician. Before come to you. Now change the physician. Now what happened? The second doctor doing what? Second doctor thinking that if the patient not explained the previously already take the medicine for this condition, then it's okay. If not explained, then what problem? A patient not explained, doctor don't know about this, and then now the patient going to second physician again apply adrophonium, and now the second physician diagnose or say myasthenia gravis or cholinergic crisis. Now the muscle weakness is exactly due to myasthenia gravis or cholinergic crisis. If the patient give response to adrophonium, it's a myasthenia gravis. If patient not give response to adrophonium, it's mean what's the give response? If muscle contraction improve after application of adrophonium, it's mean it's a myasthenia gravis. If muscle contraction not improve after giving adrophonium, it's a cholinergic crisis. Now the second physician diagnose differentiate. Hey, you already taken medication, you not inform me. The person having the muscle weakness, myasthenia gravis, first diagnosed with adrophonium. Must differentiate. If patient not giving response, if can you apply neostigmine pyridostigmine? No, we need here antidote because already very high level of acetylcholine. This happen. So it's a cholinergic crisis. The overuse can lead to cholinergic crisis. This is about the uses of this drug. Okay, now move on organophosphate. It's the last thing here in this topic. The last thing, organophosphate. What are the organophosphate? Organophosphate is a lipid-soluble thing can enter to brain or irreversibly block enzyme. If this drug, if they irreversibly block the enzyme, what's going on with the body? What happened with the body? With the muscarinic receptor, the now person with organophosphate OP poisoning. With the OP poisoning, this organophosphate used in insecticides, used in fertilizers, this organophosphate, this person heart rate going down, this person blood pressure going down, this person having lacrimation, this person having too much salivation, this person start diarrhea, this person start diarrhea, this person start sweating, this person can collapse due to this. Decreased heart rate, bradycardia, no BP, BP nil. It's organophosphate poisoning. To reverse this organophosphate poisoning, we can do something for this patient. This drug we will discuss in cholinergic antagonist lecture, organophosphate. You must understand what's going on this organophosphate poisoning inside the body. Organophosphate we can reverse, because here what happened, the sympathetic system is too much stimulated, in the patient by the entry of organophosphate inside the body. If too much parasympathetic system stimulation, the decreased heart rate, decreased blood pressure, lacrimation, salivation, diarrhea, sweating start. So this patient can collapse due to decreased blood pressure and bradycardia. So we can block this parasympathetic system by using blocking drug. These are all a stimulating drug, not apply these drug. We can use the blocking drug and also can reverse the organophosphate using one drug, polydixine. This drug in detail we discuss in our next section, the cholinergic antagonist section. And one drug is left is ecothiopate. What's ecothiopate? Ecothiopate is chronically acting. It's used for chronic glaucoma. For glaucoma, our best drug for glaucoma, pilocarpine. Best drug for glaucoma is a pilocarpine. Another drug here, another drug for glaucoma, phosphigmine we can use for glaucoma as alternative. For best is emergency glaucoma, always go for pilocarpine, local pilocarpine. Okay, the ecothiopate we can use for chronic glaucoma. Ecothiopate for chronic glaucoma. It's all about parasympathetic agonist.